Hello class, my name is Travis Chase and I did my presentation on mindfulness. What is mindfulness? Mindfulness is not just meditation. It is a technique, a mindset if you will, of focusing attention in the present to your breathing, your emotions, and your bodily sensations of your choosing. These areas of focus are used as anchors. Mindfulness is accepting the distractions that may arise whilst doing the technique with a non-judgmental attitude and kindly refocusing yourself back to your said anchor. Basic principles of what we now call mindfulness were first written in the texts of ancient Buddhist monks over 2,500 years ago. Mindfulness is part of the behavioral approach to psychiatric therapy and has its origins in the 1950s and early 1960s. Initially, behavioral approaches to psychotherapy received harsh criticism from psychoanalytical psychotherapists, but the approach has survived. By the early 2000s, a third generation, so-called wave of behavioral therapies emerged, which included mindfulness-based stress reduction and mindfulness-based cognitive therapy. Some key figures: a Buddhist monk from Theravada branch in Burma in the 18th century called Madawi wrote meditation texts encouraging other monks to return to practicing mindfulness, which they called vipassana meditation. Maharishi Sayadaw was influenced by Madawi's manuals and transformed vipassana meditation to focus on concentrating on what was happening at the present through observing bodily sensations. This method spread quickly and became popular in the West and East Asia. Joseph Goldstein, Jack Kornfield, and Sharon Salzberg in 1976 co-founded the Insight Meditation Society, IMS, in Massachusetts after learning from Vipassana teachers in Southeast Asia. The IMS is still prominent mindfulness meditation, or still is a prominent mindfulness meditation center in the West. John Kabat-Zinn in 1979 created an 8-week mindfulness-based stress reduction MBSR program at the University of Massachusetts Medical Center. This greatly influenced mindfulness popularity in the West over the last 35 years. He made no mention of Buddhism, though, for fear that any mention of religion would cause resistance to acceptance of this technique. Some key terms and concepts. Mindfulness, as Corey describes, is a process that involves becoming increasingly observant and aware of external and internal stimuli in the present moment, and adopting an open attitude toward accepting what is, rather than judging the current situation. Zerbo et al. Defines mindfulness as a state of mind that appreciates the flow of consciousness in real time and with acceptance. Mindfulness-based stress reduction, or MBSR, was developed in 1979 by John Kabat-Zinn. It is an 8 to 10 week group program using mindfulness techniques. It assists clients with coping with stress, promoting psychological and physical health. Mindfulness-based cognitive therapy, or MBCT, is an approach that mostly focuses on treating depression. It is an 8-week group treatment program of 2-hour weekly sessions adapted from MBSR and integrates cognitive behavioral skills learning for clients. It includes teaching self-compassion and kindness. Self-compassion is an essential component to MBCT. It is to be understanding and accepting of ourselves when we suffer or fail, instead of criticizing ourselves. Third force, generation or wave is an alternative to psychoanalytical and behavioral approaches to psychotherapy, which includes dialectical behavioral therapy, or DBT, acceptance and commitment therapy, or ACT, as well as MBSR and MBCT. Another term to understand is heart rate variability, used in some studies to perceive stress level. And the variability of the heart rate is seen as that level of stress severity. Focusing or noticing is an important concept of mindfulness meditation. For example, when performing mindfulness, one focuses on their breathing. Dual awareness is being able to be aware of more than one experience at a time, to be able to be in the present while at the same time allowing yourself to experience sensations of the past. The past becomes the present, allowing the patient to re-experience the sensations. According to Zerbo et al., mindfulness therapies are gaining evidence for treating symptoms of depression, anxiety, pain-related disorders, eating disorders, addictions, and attention deficit hyperactivity disorder, ADHD. Mindfulness teaches patients to become aware of thoughts, feelings, while being able to detach from the experiences, treating them as mental events instead of facts. This ability to detach helps to prevent negative, distorted thoughts from spiraling downward. MBSR promotes self-observation of internal emotions with an open and non-judgmental stance. These learned techniques allow the patient to view their feelings with self-compassion, giving them a more positive experience of their perceptions, behaviors, and reactions to stressors. I have a case study here for us. Joel is a 45-year-old Caucasian male. He's a registered psychiatric nurse who works in a busy psychiatric inpatient facility. He reports chronic back pain and has been treated by pain management with long-term narcotic medication. Now his pain management provider is trying to wean him down on his narcotic use, and he has been referred to psychiatry for psychotherapeutic techniques to help him achieve this goal. In addition, the patient reports work stress that is exacerbated when he is in pain. My assessment is situational anxiety, chronic pain syndrome, and long-term current use of opiate analgesic. My plan: after the initial therapy session with the patient agrees he will start an 8-week mindfulness-based stress reduction program that he will participate in 2 days per week for 2-hour sessions each. He will his focus will be on stress work reduction as well as reducing opioid cravings. The goal will be that the patient will be able to tolerate a 30% reduction in his opiate analgesic use by the end of the 8-week program. The patient will continue to work with his pain management provider during the MBSR treatment program to monitor his opiate weaning goals. In addition to the MBSR 8-week program, the patient will use the free smartphone mindfulness application offered by the Department of Veterans Affairs on the Google Play Store called Mindfulness Coach version 2.1. He will perform at least one 10 to 20 minute audio-guided mindfulness meditation session from the Mindfulness Coach app. We could also consider teaching Joel progressive muscle relaxation techniques. Outcomes will be measured using the Self-Rating Anxiety Scale, or SAS, the Nursing Stress Scale, as well as the patient's self-reported log of opiate analgesic use. My formulated reasoning: Baker 2018 suggested mindfulness positively correlates with reactions to opioid cues. This suggests mindfulness may help Joel better tolerate his weaning from his current opioid dosing. Bostock 2018 reported the use of smartphone application for 10 to 20 minute audio-guided mindfulness meditation daily for 8 weeks reduced work stress with participants. The mindfulness app should augment the results of the MBSR program and give Joel access to sessions anywhere and at any time. Also, Bostock 2018 results showed sustained benefit for at least 8 weeks after the daily use of the app for the initial 8 weeks. Yang 2018 reported MBSR resulted in reduction in work-related stress and mental health and improvement in mental health for psychiatric nurses. The participants closely resemble Joel, as he is stressed out and a psychiatric nurse. Therefore, use of MBSR should result in similar stress-reducing results for Joel. Progressive muscle relaxation techniques are a type of mindfulness technique that assists patients in full-body relaxation, in which patients clench and relax muscles from head to toe. So here's a technique treatment approach here. This is progressive muscle relaxation and is a type of mindfulness technique utilized. So basically, the therapist will explain to the patient that the exercise is for reducing tension and recognizing where tension might be stored in the body. The method involves tensing and then relaxing muscles progressively from head to toe, or actually the opposite direction rather. And you do each muscle group individually. You tense each muscle group for 10 seconds and then relax each muscle group for approximately 10 to 15 seconds thereafter. Breathing should be slow and even. You should start in a comfortable position, focusing on taking deep breaths in and slowly exhaling. Begin with your toes and feet moving upwards in muscle groups. You guide the patient through each muscle group, counting to 10 for each muscle group tensed, and then telling them to just relax the muscle group. Move all the way to the muscles of the forehead. An alternative ending could be to have them finish by focusing awareness of their mind, their thoughts, and then saying, "Relax your mind." I learned this from doing group meditation with a priest in high school many years ago, and it worked great. Here's another exercise that you can do with mindfulness, a different mindfulness technique. So there are many different focuses of mindfulness that can be utilized. These focuses may be on sound, bodily sensations, breath, or physical touch. The focuses are considered anchors that we can use while practicing mindfulness, and as thoughts come into awareness and attempt to distract us, we can kindly, without judgment, accept these thoughts or experience and then gently refocus on the anchor. Below is a mindfulness meditation exercise with a focus on breath. So this would be mindfulness of the breath. You can set a timer anywhere between 3 to 10 minutes. Sit in an upright, relaxed position with your spine straight and comfortable with eyes closed. Gently scan through your body, inviting any areas holding tension to soften. Set the intention to notice your breath. You can say to yourself, "Now I choose to observe my breath." The breath is the anchor for your attention. Begin by noticing the many sensations and movements that are present during an inhalation and exhalation. You may observe the expanding and contracting of the chest, the rising and the falling of the shoulders, or movement in the belly. Eventually anchor your attention to one particular aspect of the breath. We recommend focusing on the belly, the rising and the falling of the abdomen, because doing so often facilitates a deeper breathing. When you notice that your mind wanders away from the breath, gently invite yourself back to this moment of breathing. If you would like, you may count in your head after each breath, making a note of 1, then 2, and so on up to 10. If you lose your place, start over with 1. Even if you count to 3 over and over again, what is most important is that you recognize that your mind has wandered and then bring it back again. This recognition that your mind has wandered and then returning to the task is as much a part of the meditation as the sustained attention on the task itself. The numbers simply serve to help you notice when your attention has wandered. When your timer chimes, congratulate yourself for taking the time to practice the mindfulness. And this was picked up through a mindfulness book by Zerbo, 2017. I have a video link here by James Kirby that displays an example of a mindfulness therapy session. Please check it out when you have a chance. So here are a few evidence-based practice studies. There was one done by Baker. It's called the Autonomic and Effective Mediators of the Relationship Between Mindfulness and Opioid Craving Among Chronic Pain Patients. And this study basically showed an indirect correlation of mindfulness reducing both opioid cravings and depression among chronic pain patients on opioid pharmacotherapy. They did utilize the heart rate variability, HRV, to determine these outcomes. Bostock, Crosswall, Prather, and Steptoe had an article, Mindfulness on the Go, that highlighted a mindfulness smartphone application that could be used, and they performed a study with subjects that did show a correlation with decreasing stress in the subject group in the study. They had to use the app for 10 to 20 minutes, and it gave guided auditory meditation sessions. They did it, daily, and then at the end of 8 weeks, they had to do a scale showing that they had improved their stress and so forth. Yang, Tang, and Zhao had an article on the effect of mindfulness-based stress reduction therapy on work stress and mental health of psychiatric nurses. So I thought that this was a very good study for the case that I had. And this study showed that MBSR therapy reduced work stress, depression, and anxiety among psychiatric nurses and improved their mental health. They utilized the symptom checklist 90, self-rating depression scale, self-rating anxiety scale, and nursing stress scale to monitor the outcomes. And significant decreases in all scales were observed in the MBSR group with no significant change in the control group. That was pretty good evidence. Here's some resources that I've listed. Please check these out when you have a minute, but there are lots of resources, and I just narrowed it down to this slide here, but mindfulness resources are very easy to find online, and there are many schools that provide certifications and trainings like UCSD, UMass, and then there are different, you can use these smartphone apps and things, so lots of resources. So in conclusion, mindfulness has roots in ancient times dating as far back as 2,500 years ago in Buddhist teachings, and over the last 35 years, mindfulness has been popularized in the West. Evidence-based research on mindfulness has been mounting, and many psychiatric practitioners have come to appreciate mindfulness therapeutic benefits. Mindfulness has various standardized programs with evidence-based outcomes that should be considered in a psychiatric mental health nurse practitioner's arsenal of therapeutic techniques for a broad spectrum of psychiatric disorders as well as general client well-being. Here are my references, and I have a study guide for you as well. Thank you.